Hello, hello. My name is Victoria. It's so nice to meet you. I'm going to be your nurse today. And today we're going to be talking about three things. We're going to be talking about deep vein thrombosis, pulmonary embolisms, and NAS. These are all very important topics now that you're pregnant, and we are going to jump right into them. So first, with deep vein thrombosis, that is when you have a thrombus somewhere. Most of the time it's in your legs, it's in your calves, and that is going to cause it can be very dangerous because that clot can break off and cause a pulmonary embolism possibly. So we want to watch out for that. If you have a deep vein thrombosis, you're going to have some signs and symptoms of pain, swelling, tenderness in one leg. It's not going to be bilateral, it's going to be unilateral, so it's going to be on one leg. And you may feel like pain, like this weird, like instantaneous, like sort of cramping in your leg or something of that sort, and it's usually in your lower calf. And the pain may be worse when you bend your foot upwards towards your knee. So because of that, we aren't going to be doing a Homan's test. We don't want to risk anything with regards to that. You may also feel a heavy ache or warm skin in the affected area, and the skin may be red, particularly the back of your leg below the knee. So these are all things that we're going to be looking out for, and nursing interventions that I will do is just kind of monitor your legs and compare them visually with my eyes and measure if there's any sort of difference in between the legs. And I'm also going to be asking you for these signs and symptoms and seeing how you're feeling throughout the time. Now, there are many risk factors that contribute to deep vein thrombosis. For example, obesity. And actually, looking at your chart and everything, it has come to my attention that your BMI, your body mass index, is actually in the obese category. So that does impact your risk factors for certain things, your percentage of risk factors. So that does put you more at risk for deep vein thrombosis and pulmonary embolism. So we do just want to be extra diligent in that. And I am in no way, judging you in that way. It's a fact of the nature. So we just want the best health for you and your baby. So we are here for you 100%. Other things that can cause or that are risk factors for deep vein thrombosis are family history of blood clots, if you're over the age of 35, smoking, again, obesity, and that is because fat cells hold extra estrogen, and having large estrogen doses is what ultimately is the biggest thing for deep vein thrombosis. So when you're after delivery and during pregnancy and all this stuff, your body is being surged with lots of estrogen, lots of hormones, and that puts you at greater risk for deep vein thrombosis. And that's why we're having this conversation. We really want to make sure that you're safe and that nothing is going to be jeopardized in your health. We're also going to be looking at your smoking history. If you're a smoker, we're going to be seeing if you're delivering multiple babies, if you have had fertility treatments, if you have had severe painful varicose veins throughout your pregnancy or history of, if you're dehydrated, if you have any severe recent infections or injuries, especially a broken leg. These are all things we want to consider for risk factors for DVT. So again, our treatment or our nursing intervention is going to be measuring the circumference of the leg. Next, we are going to be talking about pulmonary embolisms, and that is when a thrombus or something, an emboli, travels into your lungs and really puts you at a major risk. This is fatal, and we really need to be adamant about watching for signs and symptoms. So first, let's go over those signs and symptoms. We're going to be having acute immediate chest pain with difficulty breathing, and oftentimes a patient, so if I saw you go like this, fist to chest, that's called the Levine sign. I'm going to be worried, oh my gosh, is she having a pulmonary embolism? What do I need to do? So if I see that sign, the first thing I'm going to be doing is raising the head of the bed. We're going to start O2 stat. We're going to call a respiratory code, and if the respiratory code doesn't work, we're going to call a code blue. So we are going to be on top of this if we see any signs and symptoms. Other signs and symptoms besides the Levine sign, which is clutching the chest when you have immediate chest pain, difficulty breathing. We're also going to be seeing coughing up blood, an increased heart rate, a tanking blood pressure, and your blood oxygen saturation. So when we take the pulse oximeter on your finger, we're going to be seeing a decrease in your oxygen saturation levels. So that's why we really want to push that O2. So those are nursing interventions. But risk factors for the pulmonary embolism are previous pulmonary embolisms, pregnancy, like we said, we're in pregnancy. Let's see, if you had any recent surgical procedures, if you are immobile, and that goes for deep vein thrombosis as well. The immobility is a big deal. That's why if you have a C-section, we're going to be really adamant about checking all of these things because you will be immobile for a certain time. And a big prevention for all of this is staying mobile as much as possible, practicing your foot exercises in bed, making sure you move your joints. We want to put SCD stockings on you, which is going to kind of milk your calves throughout the day. And that's going to be great for preventing pulmonary embolisms and deep vein thrombosis more so. But these are all things that we are going to be looking out for. Also, dehydration can be, a reason for pulmonary embolism, systemic infections, smoking, deliveries greater than 3, again, obesity. So like we said, you are in the obese body mass index category. So we're going to be watching out for that. And also the age of 35 is also very, greater than 35 is also very important to keep in mind. So in order to diagnose a pulmonary embolism, we're going to be doing an MRI, a CT, or a VQ. And also, I'm going to start treating you as if you have a pulmonary embolism as soon as I see signs and symptoms. So yes, those are the DVT and the pulmonary embolism. And we're just going to be keeping watch over you for those to make sure that nothing bad happens to you during your wonderful experience of birth. Very excited about it. Next, let's talk about NAS. So NAS is something extremely, extremely serious. Let's get into that information. So NAS stands for neonatal abstinence syndrome, and this is basically what happens when a mom is using drugs throughout her pregnancy and the baby is born, and then all of a sudden, that flow of drugs is stopped and that baby is no longer getting their fix with drugs. So we are going to see some tough signs and symptoms. We're going to be seeing frequent yawning, frequent sneezing, diaphoresis, which means sweating. Babies should not sweat. And if we see a baby sweating, we are definitely going to be worried about the possibility of NAS. We're also going to be seeing kind of high breathing patterns. They might be breathing more. They're going to be shakes and tremors. They're going to have a high-pitched cry. They're going to be more fussy. They're going to be twitching, and they may have seizures. They might also have a fever. And there's going to be a thing called hypertonicity, which is when the baby is just so stimulated and the drugs are in their system. So they're going to be tonic. They're going to be flat like a board. So when your baby is born, a normal baby's head should be loose and should be able to move and bounce. So when you pick up a baby, their head should go back. But if a baby is actually experiencing NAS, their head is going to be rigid and they will be able to hold their head up, that's not a good sign. Your baby, should not be able to have its head erect when you pick them up. The baby might also experience diarrhea. They might have slow latching or uncoordinated sucking, so they're going to be having difficulty feeding. There's a whole bunch of sad things that NAS entails, and we really want to take care and watch out for our babies and do the best to take care of them. So when we see signs and symptoms of NAS, there are some medications that we will be treating with, such as phenobarbital slash clonidine, and this decreases the CNS irritability, and it also prevents seizures. So these baby CNS systems, like, they are so overactive, they're overstimulated, so they're going to be irritable, and we want to decrease the stimulus. We want to help prevent seizures. We're also going to put them on morphine or methadone or buprenorphine, which is going to help wean the baby off the drug since their body is used to it. And morphine, just to let you know, is the drug of choice. But we're never going to give a baby an Narcan. That is not the best idea. So again, as I said, we're going to be watching out for NAS signs and symptoms. It can be a very tough, scary thing. And we're going to be using the Finnegan scoring tool. And upon weaning the baby, if suddenly the Finnegan scoring goes up, that means that the baby isn't tolerating the weaning well, and that we're weaning the baby too fast. So we're gonna increase their, morphine dose back to what it once was. So these are all things that we're going to be looking out for. There is no judgment with deep vein thrombosis, pulmonary embolism, or NAS. We just want you to be aware of the signs and symptoms, treatment, diagnosis, and just how we can be here for you and care for you. So I hope this answered any questions. Feel free to ask away. Again, congratulations. I can't wait to see you experience the wonderful gift of birth and life. Okay, bye.